Welcome back to another episode of the Lost Book of Herbal Remedies. I'm Alex.
And I'm Emma. Today, we're diving deep into the evolving landscape of cardiovascular health, particularly how the COVID-19 pandemic has impacted heart disease and the role integrative therapies can play in improving patient outcomes.
That's right, Emma. Cardiovascular diseases, or CVDs, remain the leading cause of death globally, and this has only been exacerbated by the COVID-19 pandemic. We're talking about conditions like coronary artery disease, acute myocardial infarction, and stroke, each of which has seen increased severity among patients during the pandemic. This has created an urgent need for a more comprehensive understanding of cardiovascular health, taking into account factors like obesity, socioeconomic disparities, and innovative treatment strategies.
Absolutely, Alex. Recent research has shown that during the pandemic, patients undergoing invasive diagnostics for coronary artery disease needed longer stents, used more contrast dye, and required lengthier procedures. This points to a significant progression in coronary atherosclerosis during this period, highlighting just how much the pandemic has intensified these already serious conditions.
And it doesn't stop there, Emma. The pandemic has also brought to light some glaring disparities in cardiovascular mortality rates, particularly in relation to income and regional factors. A study from Korea, for instance, revealed that while the country had lower mortality rates for certain types of strokes compared to the OECD average, the 30-day mortality rate for acute myocardial infarction remained higher. What's more concerning is that these disparities were more pronounced among socioeconomically vulnerable populations, emphasizing the need for targeted interventions to bridge this gap.
It's clear that cardiovascular health isn't just a matter of managing biological risks. Socioeconomic factors play a huge role in patient outcomes, and this is something that needs to be addressed at both the national and global levels. But another key factor that's gaining attention is the role of obesity, particularly central obesity or abdominal fat, in cardiovascular risk. Research from China has shown that individuals with central obesity face significantly higher risks of cardiovascular events, even if their overall BMI is considered normal.
That's a really important point, Emma. It means that we need to go beyond just looking at BMI when assessing cardiovascular risk. Central obesity, which refers to the accumulation of fat around the abdomen, is a more accurate predictor of heart disease and stroke. This shifts the focus towards a more nuanced understanding of obesity and its impacts on heart health, and it suggests that interventions targeting abdominal fat could be crucial in reducing the incidence of cardiovascular diseases.
And this is where integrative therapies come into play. With the growing recognition of these complex factors influencing heart health, there's been a surge in interest in traditional Chinese medicine and other integrative approaches as complementary treatments for coronary heart disease. One study we came across explored the effects of due meridian moxibustion combined with ear acupuncture in patients with coronary heart disease and insomnia. The results were promising, showing significant improvements in clinical symptoms and serum neurotransmitter levels.
Integrative therapies like these offer a more holistic approach to cardiovascular care. They don't just address the physical aspects of heart disease, but also tackle related conditions like insomnia, which can have a profound impact on overall health. By improving sleep quality and regulating neurotransmitter levels, these therapies can enhance the effectiveness of conventional treatments, providing a more comprehensive care strategy for patients.
It's exciting to see how these traditional practices are being validated through modern research. But beyond traditional Chinese medicine, there's also a growing interest in herbal remedies for supporting cardiovascular health. At Herbal Bloom, we've developed a formula that leverages the power of nature to address the complexities of cardiovascular diseases.
Exactly, Emma. Our herbal formula focuses on reducing oxidative stress and inflammation, managing blood pressure, and improving lipid profiles. It also targets central obesity, which, as we discussed earlier, is a major risk factor for heart disease. Let's break down some of the key ingredients in this formula.
First on the list is hawthorn, a herb that's well documented for its cardioprotective effects. Hawthorn helps improve coronary artery blood flow, reduces blood pressure, and enhances heart muscle strength. It's particularly beneficial for patients with coronary artery disease and heart failure.
Garlic is another powerhouse ingredient in our formula. Known for its ability to reduce blood pressure, lower cholesterol levels, and slow the progression of atherosclerosis, Garlic addresses some of the key risk factors for coronary artery disease and stroke. It's backed by numerous clinical trials that support its role in cardiovascular health.
Turmeric, with its active component curcumin, is another essential ingredient. Curcumin has potent anti-inflammatory and antioxidant effects, making it particularly useful in reducing the inflammation associated with heart disease and improving endothelial function.
Ginger is also a key player. It contributes to cardiovascular health by lowering blood lipids, moderating blood pressure, and offering anti-inflammatory benefits. Studies suggest that ginger is effective in managing conditions like hyperlipidemia and hypertension, which are common in cardiovascular patients.
We've also included omega-3 fatty acids, sourced from flax seeds or fish oil. These are essential for heart health as they help reduce triglycerides, lower blood pressure, and decrease the risk of arrhythmias. The American Heart Association even recommends omega-3s for the prevention of heart disease.
Green tea is another powerful component, rich in catechins that have been linked to a lower risk of coronary artery disease and stroke. Its antioxidant properties and ability to improve cholesterol profiles make it a valuable addition to our formula.
And last but not least, we have Arjuna, a staple in Ayurvedic medicine. Arjuna is known for its ability to improve cardiac muscle function and reduce symptoms of heart failure and chest pain. Clinical studies have validated its use in treating ischemic heart disease and heart failure, making it an excellent addition to our cardiovascular support formula.
What's great about this formula is that it's designed to be part of a broader integrative approach. This means that in addition to taking these herbal supplements, we recommend incorporating dietary changes, such as following a Mediterranean or DASH diet, engaging in regular physical activity, and practicing stress management techniques like meditation or yoga.
It's all about creating a comprehensive plan that addresses cardiovascular health from all angles. And as always, it's important to consult with a healthcare provider before starting any new treatment, especially if you have existing cardiovascular conditions or are on medication.
The interplay between cardiovascular health, the impacts of the COVID-19 pandemic, and the potential of integrative therapies highlights the need for a multifaceted approach to managing heart disease. By fostering collaboration between traditional and modern medical practices, we can enhance the overall quality of cardiovascular care and better meet the diverse needs of patients.
We hope today's episode has provided you with a deeper understanding of the challenges and opportunities in cardiovascular health and how integrative therapies can play a role in improving patient outcomes.
Remember, you can explore more about these topics and discover our herbal solutions at herbalbloom.org.
Don't forget to subscribe for the latest updates on episodes, articles, and health tips.
Stay informed, stay healthy, and we'll see you next time.
Thanks for joining us today. Take care, everyone.